the first contact that I exchanged with the guy that I met my first week of college at Boston University, who's now my husband, was he didn't ask me for my phone number. He didn't ask me for my email address. He, in fact, asked me for my AIM screen name. How many of you guys remember AIM? I was Princess Aurora after my favorite Disney character, and he was D-Tugs 725, a combination of his name and birthday. I mean, it's so funny. You pick these names when I think I was maybe 14 years old, and here I am, an almost 18-year-old, meeting someone who is going to be the father of my children, right? And I'm giving him a name that is after a Disney princess character. But that's how communication was back then. AIM, for anyone that remembers it, was the AOL messaging platform. And that was what we gave out. And why did I give that to him? Why did I give him my AIM screen name as our first form of communication? Well, it was really because it wasn't that revealing. I wasn't at that level yet where I was ready to give him my cell phone number. I wasn't at that point where I wanted him to communicate with me. I wanted to be able to, if I needed to, just ignore him. And your patients are feeling the same way. Your patients are feeling like they want to communicate with you, but you guys aren't friends. You're not best friends. You're not calling each other and talking on the phone. You're probably not texting, at least with all your patients. I mean, you might have some patients who are friends, but this is communication when you're using platforms, Facebook, social media, without really revealing too much. You can decide how much. You can keep a safe distance, which was just like, back in my dating days, why we would exchange screen names like that. But there's three things that I think now as a business owner, especially in healthcare, that you can do and you can do really well when you want to use a platform like Facebook to communicate with your patients. And the first thing is, I really think that you can showcase your personality. That's number one. Between Facebook, your business page, between the lives you can do, and between the stories you can post, you can really showcase a more behind the scenes. You can be a little bit more fun, a little bit more engaging. Let me give you an example. My father, Dr. Daniel Witkowski, is both an obstetrician gynecologist, so he does some very serious work. There's some days he has to give patients cancer diagnosis. There's some days that he has to do major surgery. He's saved lives. He's also, though, double board certified, his other board certifications in lifestyle medicine. And lifestyle medicine is really taking your lifestyle and having it so that's what's going to prevent and reverse chronic diseases. Well, so, a big part of that is what you eat. And Dad loves to go on Facebook from his kitchen and show people what they're eating and cook foods with them and bring in the dog and his wife and his kids. And it's a different type of thing. You're not going to have, all of that in his medical practice. He's not going to have all of that, the dog, the wife, the kids, the chaos, the music in the background. That just doesn't make sense in the office. But it's a big part of who he is, and he gets to showcase that on social media. And it's really attracting the type of patients that he wants to attract. You want to do things that are fun. You want to do things that are engaging. Of course, what we're really aiming for is things that are share worthy. Because of course, it's great to be able to communicate with the people you already know, but we're also out there on such a public platform to try to meet new people. This is the same reason why, you would take advantage of a community event and say, sure, I'll deliver, a little lecture at the local library, at the Chamber of Commerce, on a BNI meeting, on that kind of a stage. You do that so you're attracting more business. You're bringing the right types of patients who hear your message to your clinic, to your office. And we want to do this as well on social media. So when we have something that really resonates with people, doesn't mean every single post has to be this post that you think is going to go viral. And nor do I want you to go on there and try to do the latest TikTok dance or floss or, whatever it is. I want you to do something that's going to be meaningful to someone. I could think of a post the other day. My brother, he's a college athlete. I have 3 brothers. So this is the middle brother. If anyone knows me, I'm one of 6 kids. So this is number 5 in line. My brother, Jake, he's a collegiate athlete currently. He's finishing up his junior year. He's a hockey player. And he said, I really think if I improved my breathing, I would improve my performance. And so I've been doing some research on breathing and finding some practitioners, both local and national. And I've been tagging them in posts about this. And there seems to be other people that are tagging people in some of the posts that I've been finding. This sounds like it's a common topic amongst the athletes. I don't think my brother Jake just made this up. And so, me sharing accounts with him, he's then in turn, potentially following those and potentially becoming a patient. So that's number 1, you want to showcase your personality. Number 2, it really does come down to communication. At this point, you have to be on a platform like Facebook if you are going to be a professional. I found out the other day. So I joined my daughter's dance studio a little bit late in the season. I didn't start in September. I was having a baby. I was a bit busy. And when she was stuck in the house in the winter, I said, it's time to sign you up for dance. So I came in late to the year. Somehow, either I didn't end up on the dance studio's email list or my email provider blocked it. Has that happened to you guys? Have you guys been waiting for an important email only to find out that it went to spam, only to find out that you had spelled someone's email address wrong? How many times has that happened? And so I needed to know the other day if she was having dance. I wasn't getting any email communication. The studio is now closed. Where did I go? I went to their Facebook page. I went to their Facebook page to realize they took April school vacation off. There was no dance that week. I wasn't going crazy looking for the emails for the dance link. It wasn't there. And so Facebook is becoming a necessity. If you're sending out email blasts to patients, if there's things they need to know, you need to have a checklist of places that you need to communicate with your patients, and Facebook needs to be one of them. That's where people are looking. That's where people are checking. Is it going to be a snow day? Are things closed for weather? Did something happen in the office? And it doesn't have to be all the doom and gloom posts. It could be exciting things as well. Maybe you're celebrating. One of my favorite local gyms is celebrating their 1-year anniversary. They said, let's all jump on Zoom and do a little anniversary toast if anyone wants to who's part of the gym. They sent out an email. They put it on their Facebook. You have to do double communication these days because the email delivery rates are down. The Facebook algorithm isn't much better. It's also down. So you really have to do double duty in your communications. It doesn't mean that your Facebook communications needs to be that much different than your email communications. Maybe a little bit shorter. Maybe you're going to include a different kind of picture, but you're doing the work once. Just make sure you are duplicating it so you're getting the word out there. So you're showcasing your personality, you're communicating. And number 3, there is that level of intimacy. So I know I started saying I didn't give my husband, my cell phone number because it was too intimate, but patients are craving a look behind the scenes. They're craving that one-on-one time with you. I said to my massage therapist the other day, I said, when she goes on Facebook Live, there's something about her voice that just triggers me being in her studio, triggers me getting a massage with her. And just hearing her, even if she's talking about, setting our intention for the day, if she's sharing some yoga moves that are going to help with that neck tension, if there's something that she's going to share, it brings me back to that moment of getting a massage with her. And I'm so grateful when she goes live. I'm so grateful when she shows up. People are feeling comforted by you. They're comforted by you in the office. When they see you, they're like, oh, you're there for me. And especially when you can have something where you're going to go ahead and call them out. Like Harvey's in the chat right now. Me calling out Harvey, I'm having a conversation right with Harvey. Harvey's saying, what communication channel would you suggest? Harvey, I suggest the one where you think your patients are hanging out, where you think your target audience is hanging out. So don't say, well, Instagram's the new hot thing. TikTok's the new hot thing. if your people aren't hanging out there, you're not going to want to be there. So, I do feel like Facebook right now, and I'll tell you one more little bonus tip as to why I think Facebook right now still is a place that you have to be. And then anything else is going to be secondary, whether it's Instagram or TikTok or Snapchat or LinkedIn, anything else is going to be secondary. I still think you have to be on Facebook, and I'll tell you why in a second. How do you know where they hang out, Harvey? You got to ask them. You got to ask them. Just, take 10 people that are, your target people and say, do you go on Facebook every day? That's a great way to ask them. You can also do a little bit of research too, just to see like what's the age right now on Facebook. What are they doing? It doesn't tend to be the kids. It tends to be a little bit older. It does sway more women. So, you've got to just figure out where they're hanging out. And I think that when you're creating intimacy, especially on social media, especially on a platform like Facebook, when you're going live, the other thing I've seen a lot of providers do really well is create groups. Create a safe space where people can hang out. Make it clear you're not there to doctor, to treat, to diagnose. This is not, in lieu of an exam, but it can be a place where you can hang out with healthy recipes, set intentions and gratitude for the day. It can be something where you're sharing lifestyle tips. It can just be, somewhere to hang out, to take the conversation online where they can just hang out with you. You have to be consistent. If you're going to start hanging out with your patients, do so consistently. Do so they can come to expect that every Monday night you're going to be in there. Every Wednesday afternoon, whatever works for you. And don't think that there is an ideal time. There really isn't. If the only time for you is on a Thursday morning, right before you start your day, and that means it's 8 a.m. in the morning, then so be it. It's 8 a.m. in the morning. It doesn't matter. It really doesn't matter. People will come back to it as well. And so I really do think when, I've had so many people come up to me at conferences and say, Sarah, I feel like I know you. I don't know them, but like we've had these conversations. We've had conversations on Facebook. You've seen me live. You've been in my house. You hear my crying baby in the background. I'm wrapping up, kid. And so, you hear and you understand what's going on. So when you meet Duke or, you meet my husband, Dan, you feel like you know these stories about him. Told you guys I'd give you one more kicker. I'm just going to see if sorry guys. One more kicker, and that is that Facebook ads. You can run ads on Facebook where you can take things where you can set up campaigns. If people have looked at one of your posts, they'll then see an ad. Or if people have engaged with one of your posts, they'll see an ad. If you run a webinar, you can put little code in the webinar to say if they saw this webinar, they'll get served an ad. You can do things where if they've opened up an email from you or they're on your email list, they'll get an ad. I don't want you to do this yourself. I don't want you to go down a rabbit hole of Facebook ads, but I think Facebook ads right now are still really novel. You can put in a lot of data to get out a lot of really good results. nutraMetrix parent company, Market America, has a division called MA Web Centers, Market America Web Centers. They can do Facebook ads with you. There is the ability, you can contract with that division for them to run Facebook ads. So it is a possibility. This can be something where as a provider, you're running a webinar, maybe you want to launch a TLS Select program, you could pixel that webinar, and that could then lead to you going online. I mean, it is crazy, right? Have you ever watched something or clicked on something and then it seems like those ads follow you and they follow you on Facebook? That's what the pixel is called. And you don't need to know that much about it. You just need to know where to go. So mawc411.com, you can find out more information. You can find out how you can purchase some of that social media. As an unfranchised owner, we do have access to this. So, if you want to, we can hang out. I can get Jason Pelland, who is the director of sales or the I think he's just the director of ME Web Centers. He can definitely help you and tell you where to go. Facebook is such a big place right now. It's such a big place that with all three of my kids, I would say in the 20 minutes after having my babies, my husband and I were talking about how to craft the perfect Facebook post to announce the birth of our kids. I mean, it's that kind of platform, where people are waiting, they're refreshing. They knew that that's where it was going to happen first. That's where they were going to see the first picture. That's when they were going to find out the gender and the name. I mean, if it's a platform that is that important, that it's such a critical time that you're coming and you're, sharing news as big as the birth of a child, that that's where people really do want to hang out. They do want to communicate. And I hope that you're using Facebook to communicate with your patient.